The CDC data also suggests that COVID-19 transmission in suburban and rural regions sometimes outstrips that in densely populated urban cores. And so the recent outbreaks of COVID-19 among California farm workers in counties such as Imperial County, what we're talking about today, or other places like Oxnard or Hanford, illuminate the central role of the workplace in COVID-19 transmission in rural and suburban geographies. In our report, in our brief, we examined the relationship between the percentage of households in a county in which people worked and lived below a living wage. And so for those of you that might be unfamiliar with the term, a living wage is the minimum amount that someone needs in order to avoid consistent and severe housing and food insecurity. Our analysis looked at the relationship between the percentage of households in a county that had workers and lived below a living wage, and COVID positivity test rates. And we found a strong relationship between low wage work and COVID-19 positivity. We also identified the industries that have the greatest prevalence of low wage workers and the likelihood of federal paid sick leave by the industry of workers, based on the exemptions that exist in the bill. And so our main findings were that, first off, 18 of California's 58 counties, as of a couple days ago, had COVID-19 positive test rates above 8%. Right, the state set certain thresholds for opening local economies back up, and one of the stipulations was that positivity rates need to be below 8%. As of July 8th, California had 18 counties that had positivity rates above 8%. And what we found was a striking relationship between what we called county level worker distress, which is the percentage of households working and making less than a living wage and living in households that were larger than the state average. So we found a relationship between worker distress and positivity rates. Most counties that were above the state average, with worker households making less than a living wage and the size of the household, most counties that were larger than the state in those two measures were on the state's COVID-19 watch list with positivity rates above 8%, 12 out of 15. This included Imperial, which has 35.8% of households in Imperial are characterized by workers making less than a living wage. That's third highest in the state. There's an average of 3 people per household in Imperial, which is fourth highest in the state out of the 58 counties. On the flip side, most counties with a low worker distress, those that have lower than average percentages of worker households making less than a living wage, or lower than average size households. Most counties with low worker distress were marked by low COVID positivity. Only 4 of the 39 counties that had low worker distress were on the state's watch list of counties that have above an 8% COVID positivity test rate. What we're finding is that there's a relationship between worker distress and COVID positivity that's constant across rural, suburban, and urban geographies. One other thing we did in the brief was to look at positivity by industry. One of the other things we looked at was the percentage of worker households making less than a living wage by industry. So we identified some industries in which worker distress would be highest. Agriculture was at the top of the list, followed by accommodations and food services, administrative and support and waste management, transportation and warehousing, and retail. So we've been hearing stories about farm workers. We've been hearing stories about Amazon workers, warehouse workers. We've been hearing about stories about grocery retail workers falling sick on the job. Essential workers who have no choice but to essential workers who are not mandated to stay at home, many of them who are low-wage workers and fear the repercussions of missing a day of work because they risk constant and severe housing and food insecurity even when they work. And so our recommendations are reporting COVID-19 positivity by industry, so that we can understand how industry's trends affect COVID transmission, and so that our policy can play a critical role in developing appropriate workplace health and safety standards. We also recommend improved workplace health and safety standards, and which not only protects workers, but would then protect the communities that they return to after working. And lastly, we recommend a greater safety net for workers in essential jobs. Millions of workers, most workers, are exempted from the Families First Coronavirus Response Act stipulation of paid sick leave. About 80% are exempted because they work for employers that have over 500 employees or under 50 employees. The act only applies to those persons who work for private employers between 50 and 499 workers, and most Americans don't work for firms of that size. And so our last recommendation is a greater safety net for workers in essential jobs, because millions lack access to traditional unemployment benefits like undocumented immigrants, guaranteed sick pay because of the gaps in the FFCRA, or even affordable health coverage. So such workers may have no choice but to work. And so consequently, if we were to implement better health and safety standards by industry, if we were to develop them and to implement them, it would still be necessary for us to have a safety net in order to enhance the policy efforts to reform workplace health and safety standards.
Thank you, Professor. Thank you so much for that very important information. I don't know if we have any questions for Dr. Flores. Please, if you have questions, you have the chance now or at the end as well.
Pilar, if I could ask Professor Flores, this is such valuable data in the policy brief. I just want to underscore its relevance to Imperial County. What you're describing is a pattern that is highly visible in Imperial County. The connection between workers who make distressed wages, if you will, wages below a living wage, and live in complex households, households with more crowded conditions. So they have to go to work, they have to return home to crowded living conditions. Therefore, the standard healthcare guidelines, the public health guidelines for COVID, seem to be irrelevant. They don't match the living conditions of the people who have to go to work in order to survive on a sub-minimum wage. And then if they were to stay at home or even go at home, they wind up in very crowded conditions. And you factor in just 2 hospitals for Imperial County. Could you just connect the relevance of your data to the public health guidelines that seem to be geared to more mainstream living conditions?
Yes, absolutely, Sandy, and thank you for making those connections clear. So, as you say, the guidelines for reducing COVID transmission were developed in a way that applies largely to middle-class people that can afford to stay home from work, that can afford to miss work. And the guidelines that we have, even when we debate whether to close down businesses or to open them back up, because we're so focused on regulating public behavior and opening and closing of businesses, our guidelines are not addressing the reality that there are a certain number of people that will have to work regardless. There are certain sectors of the economy that will continue to run regardless. We eat every day, and that food comes from somewhere. And so if we're failing to address where it is that COVID was surging during the entire time of stay-at-home orders, then the problem is not going to go away when we have stay-at-home orders. It's going to continue to spread in ways that confound the experts who are trying to give us guidance on how to reduce the spread of COVID.
Okay, well, thank you so much, Dr. Flores. I think we're going to move on because we have 4 more speakers. So, and we're going to go right into the community of Imperial County to hear from the people who are there on the ground. First, we're going to Luis Olmedo, Executive Director of Comité Cívico del Valle, Inc. Señor Olmedo, adelante. Please unmute him. Okay, thank you very much.
Yeah, hi, good morning. And I'm very appreciative of all the experts in the room. And thank you, Dr. Flores, for characterizing the inequities and the social determinants that really make it difficult for us to be able to have a good handle of COVID. The way that we look at it is that this entire country was not prepared to deal with a pandemic. You know, the political divisions, the lack of political will to address and to invest in these inequities that have been long characterized for many years through academics, through healthcare, through many experts, have gone ignored. And now we're dealing with COVID in a reactive manner. In the Imperial Valley, we have been dealing with endemics for a very long time. We have been dealing with deep cuts to our frontline workers, to our healthcare, who have never had, ever had, the necessary resources to deal with the population that lives here, the economy that was created here for the border region. We are a major port. When we think about ports, we need to look at the bigger picture, not just the Bay Area, not just New York, not just Los Angeles or the San Diegos. We're a major inland import port that also needs to get the same type of infrastructure and investment from the federal government and the state. We are interconnected in Mexico. It's not about pointing the fingers across each way. It's about recognizing and acknowledging the fact that we have a much larger population. We're a metropolitan area. Just because California sees us all the way to the border and then stops their characterization of our border region and looks at it as a rural, sparsely populated area, that could not be farther from the truth. And the legislature has failed to recognize our daytime population, and previous administrations have failed to recognize our population. That's why we were underprepared, under-equipped, and years of deep cuts to our nonprofits, to our healthcare locally, have also put us in a reactive situation right now. It is natural to understand that whenever you have a crisis, as we do right now, that you're going to deal with the crisis in the most critical, those most critical ill, those are in the hospital, in the emergency care, and retool and re-equip. You know, from conversations that I've had with our local hospital, which I stay more in contact with, Pioneer Memorial Healthcare District, who is one of our partners, and they have the room, they have the space, they need the medical staff. You know, the county has, in recent reports, have reported that we are medically underserved. We don't have the medical staff, we don't have the doctors, we don't have the equipment. And as it was mentioned by the medical expert earlier, we cannot rely on shipping our patients, our critical ill, to other hospitals, because we put them at risk, not only to the patient, but also to other regions. We have to, now that we've been months into this crisis, into this pandemic, we need to now have peripheral vision in our elected leaders. I'm very thankful that we have leaders such as our Assembly member, Eduardo Garcia,